Hello and welcome to today's talk. I'm Dr. Sonali Santhanam from Birth Basics and welcoming here all of you here today for Breastfeeding Week celebrations and talks. I'm hoping all of you have a lot of questions. We're going to cover specifically nutrition on breastfeeding, nutrition for breastfeeding mums, and today's talk is brought to you by FirstCry and FirstCry Parenting. So welcome, I can see a lot of people are tuning in, that's really nice. Let's get started. So before we talk about nutrition for breastfeeding mums, the most important thing we want to address is how milk is actually produced. Okay, so that's what we're going to get into first before we address actual nutritional concerns. So I can see a lot of people are logging in. Hi Kundan, hi Tanisha, hi Shazib, welcome. Nice to have all of you here. Good, so we're going to start with talking about how breast milk is actually produced, and this is very important for you to understand before you think about what you need to eat in order to make more milk, because you'll find that nutrition has a supportive role, but it's not the primary driver for breastfeeding and milk production. So with that in mind, when does your body start making milk? So I'm hoping some of you here are pregnant mums, and this information is very relevant to you because your body starts making milk when you are at about 16 weeks into your pregnancy. From 10 to 15 weeks of pregnancy, there's maximum growth in the breast tissue. And that's why there is sometimes soreness in early pregnancy in the breast. Okay, so a woman's breast is not fully mature until she has actually had a baby and breastfed a baby. So that's the kind of growth that we are seeing in this pregnancy phase. So by about 15 to 16 weeks, your body is already making milk. And all of this is controlled by the hormone surge in your body that is supporting your pregnancy, supporting your future journey into breastfeeding. Okay, so when we look at this whole stage, this is Lactogenesis 1. This is your primary driver, and it's a very important phase in order for you to be able to make more milk in the future. Now, once the baby is born, for the first 3 to 4 days, you're still in this Lactogenesis 1 phase where your body is still beginning to understand how much milk to make, what the baby's requirements are, what your body, so it's an adjustment phase. Only by about day 3 or 4, your body is actually going to start making milk. And at this point, sometimes your body makes a little bit more. So we call it a phase of copious milk production. So in the first 3-4 days after birth, a lot of moms are very concerned. They don't know, they don't understand why their breasts don't feel any different. This is a very normal phase, and a lot of times the primary question we get is, what can I eat to make my milk come in? Now, actually, nothing that you eat at this phase is going to really support you with, of course, you want to hydrate yourself and you want to eat at regular intervals, and this is going to help. But the most important thing at this phase is ensuring that the baby comes to the breast very often, is constantly being fed as per the baby's demand. So they are going to express signs of hunger possibly every 2 to 3 hours. It's very important to ensure that you are getting the baby to the breast very often, ensuring that the breast is emptying out efficiently. So the more milk you give your baby, the more milk you're going to get. But there are some other factors that do come into play when we talk about milk production, even at this phase. How much milk making glands does the mother have? This does have an impact on how much milk she's going to make. Okay, so also, did she have any hormone treatments when she was planning her pregnancy? What kind of breast growth did she experience during the pregnancy phase? Was there a phase of maturation which she noticed? Some amount of soreness. All of these things will play an active role in her maximum milk making capacity. Okay, so these structural issues are very important to understand, because very often people think it all comes down to food. But food, like I keep saying, plays a supportive not a primary role when it comes to breastfeeding. Okay. So some of the other things that play a very important role at this point is the baby's oral structures, oral anatomy. The baby is able to latch very well and get milk from the breast. Your body is going to recognize how much milk needs to be made and actually provide for the baby. Okay. Now, by day 6, day 7, this is the period where your body goes into what we call an autocrine control. So you must have heard of demand and supply. So at this point, your body gets into this demand and supply phase. So the more demand for milk, the more milk will be produced. As simple as that. So it's very important to ensure that your baby comes to the breast often, empties the breast fully, and if this is not happening for whatever reason, maybe the latch is poor, maybe the suckle is weak, there are interventions that we need to do to make sure we troubleshoot over here. And if we are not able to for whatever reason, at least we need to pump to protect the mother's milk supply. Now, unless all these things happen, no matter what you eat, it's not going to have a massive impact on how much milk you produce. So once I have driven this point in, only after that I'm going to talk about nutrition for breastfeeding. Okay. So when it comes to nutrition for breastfeeding, I like to look at it from 2 points of view. Number one, from the mother's point of view. So it's very important actually studies have shown that what the mother eats doesn't really make a huge difference when it comes to the quality, the volume of milk she's going to make. Okay, so eating more, eating high amounts of fat like ghee and butter, all of this is not going to make a difference to how much milk she makes. But what you eat is going to have an impact on your health, okay, which is of primary importance as a mother. If you feel healthy, if you feel nourished internally, then you're going to be able to make more milk because the stress levels in your body will be less. Okay, so think of eating from the point of view to nourish your body so that your body is not stressed. Okay, food is something that is a basic primary, necessity. Your body needs it at regular intervals, especially when the demands are greater when you're breastfeeding. Okay, so you are going to eat at regular intervals to nourish your body, to support you in a future pregnancy, but not really with the point of view of making more milk. Now, the second thing that we look at is from the baby's point of view. So, does what you eat make a difference on the baby's health? This is a question we get all the time. So, should I avoid eating certain kinds of food? Is it going to go to the baby? This is also a very important thing to consider when we talk about nutrition when you're breastfeeding. Okay, so we'll start with talking about mother's point of view. So from the mom's point of view, how many calories do you need to consume? Now think of calories as fuel. You need to give fuel to your car in order for your car to run. Similarly, you need to fuel your body for your body to work. And this comes in the form of calories. Okay, so when you look at calories, about 300 to 400 calories more than what you would normally need, because your body is burning a lot to make milk. And some people must have heard, and I know that there is a lot of mixed feelings, anger about this. You must have heard that you will lose weight if you're breastfeeding because you burn more calories. But that is not really true at all, not because you don't burn calories. Of course you do. You burn about 500 calories a day when you're breastfeeding. But you also eat a lot because you feel hungry all the time. This is your body telling you to nourish itself. Okay, so of course the type of food you eat is going to play a big role. You need to nourish yourself. You don't need to keep filling the belly with food. Okay, so what kind of food you eat is definitely going to make a difference. So where will this extra calories that you need come from? Let's say about 2000 to 2500 calories is what you need when you're breastfeeding. Okay, now these calories will come from your macronutrient source. Macronutrients means macro, the major part of your food. Proteins, carbohydrates and fats. Okay, So out of this, if you look at it from an Indian diet point of view, we tend to eat a lot of carbs. And then of course, when you're breastfeeding, we are given a lot of fats, lot of ghee, butter, malai, milk cream, okay? Not necessary. We'll get to that in a little bit. And then finally, most ignored, protein. We need to have quite a bit, and I would say plant-based protein or lean meat if you're non-vegetarian, but not dairy-based protein. So unfortunately, whatever protein we get in our diet usually comes from dairy products. It will be milk. Yogurt, of course, is very good, but we will talk about some of these things and how they impact your baby. Okay, so let's start with understanding food from the macronutrient point of view. You need fats in your diet, definitely. You need good fats in your diet. I'm going to say this again. You need a good amount of good fats in your diet, which you will get from almonds, flax seeds, chia seeds, okay? You're going to get it from avocado, from good fish, okay, if you're non-vegetarian. But not so good sources of fat are ghee and butter. So of course you can have 1 teaspoon of ghee, but if you're going to eat a large amount of it, it is going to be stored as fat in your body, and that is not, because we know definitely that obesity, being overweight, having a large BMI does negatively impact milk production. So just, you know, eating the wrong kinds of fats is actually damaging to your breastfeeding journey. We do have a lot of cultural influences over here. There is a lot of belief that eating the laddus in the postpartum helps. To some amount, yes, because it might have a lot of, you know, sesame seeds, it might have a lot of almonds, and you know, sometimes they add good carbs into that, and that's all very good. But we need to decrease the amount of fat, that goes into these things. The second thing is protein. Now, protein is very essential, and where are you going to get this from? Preferably from lean meat like chicken, okay? Or you can get it from legumes and dals like chana, rajma, but then there's a lot of concern about all of these things causing gas for the baby. There is no real connection shown between any of these things and causing gas for the baby. You can add, you know, something like asafoetida or jeera or a little bit of ajwain along with this food when you cook it in order to bring down the gassiness for yourself, but it is not going to really cause, or there is no scientific link that we know of that really causes these issues. So sometimes having these beliefs that this is going to cause a problem to the baby can actually take away from the nutrition you need in order to support your body when you're breastfeeding. Okay? And finally, coming to carbs. Now, carbs are very essential for milk production because it forms a major source of energy for your body. But of course, we want to again think about good carbs versus bad carbs. So, you know, you just have to be wise about where this comes from. You can have oats in your diet. You can have rice in your diet. That's perfectly fine. You can choose brown rice, you can choose basmati rice because that has a less starchiness in it. Glycemic index is low. We want to choose foods that have low glycemic index. And when I talk about glycemic index, I don't know if everybody here understands it. It basically means how fast can your body absorb the sugar into the bloodstream from that food. So obviously sugar has a very high glycemic index, because as soon as you put it on your mouth, it's going to get absorbed into your bloodstream from the mouth itself. Okay, and this causes a sudden spike in your blood sugar levels, and this is not good for you in the postpartum or at any point in your life, even otherwise, because it does put you at risk for diabetes and of course some kind of hormone imbalance. So stay away from refined sugars, stay away from simple carbs like maida or anything that's going to elevate your blood sugar levels suddenly. So large quantities of rice. Of course you need to eat carbs, but you need to balance it in your meal with a good amount of protein and with a good amount of fats. So Greek yogurt, of course, when it comes to yogurt, again, it's probiotic. Even though it's dairy, I highly encourage moms to take yogurt when they're breastfeeding. Okay, so that's another good source of protein and probiotic. Now, when we talk about nutrition, and I was very clear when I took on this topic of interest to talk to mothers about, because we want to think about it as nutrition and not a diet. Okay, so there's no such thing as a breastfeeding diet. I don't like that term. I would prefer that you refer to it as nutrition because it means nourishment, right? So when we talk about nutrition, we have to talk about micronutrients as well, which is basically the smaller things that make a difference. Okay, so iron, calcium, two things that you need to continue taking throughout the process of breastfeeding. Why? For as long as you're breastfeeding, your body is taking calcium from your bones in order to provide calcium to the milk and give it to the baby. Okay, so this effect needs to be balanced with a larger amount of calcium intake for the mother. If you don't take enough calcium in your diet when you're breastfeeding, so sometimes we get lazy after the baby is born. We'll do it for the baby, we won't do it for ourselves, but it's very important. What will happen is your bones will get weaker, they will become more brittle, and vitamin D deficiency is very common in India in general because we don't go out very often. Now, during this pandemic, even more because we are at home all the time and we are not getting out. So, of course, we can expect vitamin D deficiency in the population. It's very important we get it checked, we get it treated ourselves, so that if you don't have enough vitamin D, the calcium is not going to get absorbed into your body from your natural dietary sources. So you're going to get into a cycle, and this is going to impact both you and the baby. So if the baby doesn't get enough calcium, it's going to cause soft bones. There can be bowing of the legs when the baby starts walking, rickets because of vitamin D deficiency, which used to be very common before, but now of course it is recognized, it is treated for. But your breast milk does not contain vitamin D until it doesn't contain vitamin D, and your baby is not going to get vitamin D from the sun because they can't synthesize their own vitamin D yet. So it's very important that the mother has enough vitamin D in her diet, either through the form of supplements or and have enough calcium, so that both the mother and the baby have strong bones. Okay. Now, iron is also very important because, first of all, as breastfeeding mums, sleep is something that is, we don't get enough. Okay. And fatigue is very common in the postpartum, and many times people think that it is because of lack of sleep, because of the incredible amount of time that you have to spend taking care of your baby. But fatigue can also come because of iron deficiency, and it's quite common in the postpartum again because of the increased demand on your body. So it's very important for you to include a lot of green vegetables. And when you include, and of course it's always best to take this from natural sources, because taking iron supplements can cause a lot of constipation and pelvic floor issues. So if you're dealing with constipation, you're going to have issues with your pelvic floor. Postpartum, already pelvic floor is weak, plus constipation, it's a recipe for disaster. So please include as much green vegetables, but the green vegetables that you have, you need to make sure it is taken with vitamin C. So squeeze lime on it or add orange to it. You can add tomatoes when you're cooking your green vegetables so that you get it with vitamin C. Only then the iron is going to get absorbed into your bloodstream. Otherwise, it's just going in and coming out. Okay, because green leafy vegetables have a lot of iron. They also have a lot of calcium in it, and iron and calcium always compete for absorption. Okay, so very, very important for you to include a lot of green vegetables along with a source of vitamin C in that same meal. Okay, now another micronutrient that we talk about is B12. B12 deficiency is very common in vegans or if you are pure vegetarian, it's very important for us to ensure that there is enough. So another thing that you might want to get checked for in your postpartum period. Now these things are not routinely done by the gynecologist in the postpartum, but it is something that I highly recommend that you do. Vitamin B12, iron, calcium. Balance is absolutely essential in the postpartum to ensure that your body is functioning properly, you have enough energy, and you're able to optimize the whole milk making process. Okay, so if your body is struggling, if you are fatigued, if you're tired, if you're not having enough nutrition in your food, your body is going to be in a constant state of stress. And that constant state of stress, that fight or flight response that your body gets into because it doesn't know where the next nutritious meal or when I'm going to get sleep again is going to come from, absolutely can cause an impact overall on your milk production. Okay, so we're talking right now about the effect of nutrition on the mother. Okay, we haven't even gotten to the baby yet. So the third thing when we talk about nutrition in the mother is definitely we have to think about hormone balance. So women who have thyroid insufficiencies definitely have a problem with making enough milk for the baby. If you have a hypothyroid problem in the postpartum thyroiditis is common, not recognized, unfortunately not screened for enough. Fatigue is a very common symptom of a thyroid condition. Fatigue is a very common symptom of iron deficiency. Fatigue is also something that all mothers will face in their postpartum when they are trying to recover and when they are taking care of a newborn baby. So unfortunately isn't picked up at the right time and can cause a huge impact on milk production. So in order for you to have balance in your thyroid levels, make sure that you're taking iodized salt and not, because nowadays the new trend is to use Himalayan salt or pink salt, or I see a lot of rock salt being used in food, which is perfectly fine. But you need to make sure you're also having iodized salt in your diet, because that is going to give you the iodine you require to ensure good thyroid balance. Okay, and without that it's going to be definitely very hard for you to feel energetic. Now also diabetes, when it comes to thyroid, also another thing I want to add is not taking too much cruciferous vegetables like Brussels sprouts, cauliflower, cabbage. Sometimes we tend to go on this sudden, I want to lose weight, I don't want to put on weight, so at least let me eat healthy. I'll eat a lot of vegetables. So a lot of soup with cabbage, cauliflower, broccoli, these things can be thyrosuppressive. So you want to eat it in balance, and yes, it is known to cause also a little bit of gassiness and colic in the baby. Okay, so I would highly recommend eat it, but please eat it in moderation and have a balance when you're eating all of these things. Okay, now diabetes is another thing. Postpartum, some women can develop postpartum diabetes as well. If you already have diabetes before you got pregnant, making sure that you're keeping your glucose levels in check and in balance is going to play a big role in your milk making capacity. Okay, so it is absolutely safe for you to breastfeed even if you're diabetic, and you should. It's not going to have a negative impact on your health, but you need to keep your glucose levels in check and in balance. Another thing I want to talk about when it comes to diabetes is a lot of galactogens that are available in the market. These things that we mix into our milk and have. It's very high in sugar, and people don't realize that this is going to have an impact on their blood sugar levels. So please be careful when you're taking anything that claims to boost your milk production. Okay, and let's talk about now from the mother's point of view, from the point of view of increasing milk production, if there is anything that can help you boost your milk supply from a nutritional standpoint. Now, the most important thing I would say when it comes to boosting milk production is hydration. You need to drink enough water. You need to make sure, when you're breastfeeding, your body asks for water. You will feel thirsty. This is clearly your body's way of telling you to please hydrate, right? So I would say that water plays a bigger role than food does. And when it comes to food, just eating at regular intervals, make sure you're not starving. Even malnourished women can make enough food for their babies. So from a point of view of does it help you make more milk? Well, you need to eat in order for you to be nourished. That's all. Does garlic help with milk production? There's no scientific research to prove that garlic helps with milk production. One study found that it can improve the taste of milk, and that really depends on whether your baby likes garlic. I don't know. But yes, one study did find that garlic may have an indirect role by increasing your baby's interest in the milk, ensuring more emptying of the breast, and in turn boosting the mother's milk production. Okay. Milk and bread is another thing that I see. A lot of moms are given milk and bread in the postpartum as an intervention to boost milk production. This is absolutely not true. It's not true that in fact, having cow's milk may play a very negative role when it comes to baby having colic, gassiness, problems with their stools. So there is no reason to increase the amount of milk that you're having. Drinking more milk doesn't make more milk. I'm sorry, it just does not. Okay? Cow's milk is for cows. Human milk is for humans. And one thing that will matter is making sure you're having enough fluids. And because milk is liquid, that's the only way I can think of how it will help. Okay? Bread, white bread especially, is glycemic index. We were talking about it. Very high glycemic index. Absolutely unnecessary. Is going to cause weight gain. I already saw one question in the Q&As about how can I lose belly fat. Well, you cannot lose belly fat by having milk and bread. It's not going to help. It's not going to help to have excessive amount of butter and ghee. Not going to help your milk production. Not going to help your postpartum body. Also because bread, sugar has a lot of inflammatory agents, gluten, which can actually put your body in a constant state of fight or flight. So please, please, please avoid, ignore it. Some of the other misconceptions about food and making more milk would probably be, so there's garlic, there's milk and bread, there is boiling milk with garlic. This also we don't know if there is any connection with it, and I would not recommend taking it because usually it ends up being a form of rabdi, which is milk, garlic and sugar, and then again that's a big no-no, not at all okay to have. It is highly discouraged. Now galactogens, I get a lot of questions about can I eat something like a medicine to boost my milk production. Now there's a lot of debate on this. If you're looking at galactogens like fenugreek, methi, vendayam, whatever you call it in your language, there is some amount of evidence to suggest that it does have a mastrogenic effect. So it can increase breast growth. It can increase, more proliferation of glands, and I'm saying it can. We don't know for sure, but it has some amount of a role to play. But it needs to be taken under supervision for a prescribed period of time. I see a lot of times mums start taking it right after they have their baby, and it continues for 1 year. Now this is going to have a huge impact on your blood sugar levels. Methi is also given to people who are diabetic in order to control their blood glucose levels. So we really don't know the long-term effect of this. Some studies have also talked about uterine rupture with long-term use. So I would highly discourage taking this on your own without working with someone who's knowledgeable enough to guide you. Okay. Fennel, which is saunf, is another thing that is shown to help with increasing milk production. And this can also be taken along with fenugreek under supervision, under guidance, in a prescribed amount when the baby is having periods of growth where the demand for milk increases and you need to boost the milk production. Or if you're an exclusively pumping mom and you need to have some extra support around making more milk, then you can consider these galactogens, okay? But not for everybody, not for indiscriminate use. there are certain medications that help boost milk production, because this directly works on boosting the hormones that are necessary, supportive of making more milk. Okay, like prolactin, dopamine, oxytocin. Okay, but this is completely again taken under the guidance of a lactation consultant and a gynecologist. And why I'm saying lactation consultant and gynecologist is because the gynecologist can prescribe it. A lactation consultant can guide it. Okay, so it is always important to make sure you are getting the right kind of care from the right kind of professional. All right, let's talk about nutrition from the baby's point of view when it comes to breast milk. Now, whatever you eat is going to go into breast milk and go to the baby. And this is wonderful because it is going to give your baby an introduction to different flavors, different smells, different types of food. It's also going to expose your baby to hopefully highly allergenic foods early, like peanuts, fish, shellfish. It's very important to include all these things in your diet. No kind of avoidance diet is recommended. So I'm talking about intermittent fasting, ketogenic diets, avoiding one source of food completely. Let me not eat any peanuts, let me not eat any shellfish. I don't want my baby to be allergic to these things. This is going to actually make things worse. It's important that throughout pregnancy you eat everything as long as you're okay with eating it. It's also important that when you're breastfeeding you eat everything as long as your baby is not really showing any signs of allergy. So even milk, go ahead and have it in moderation. But only if the baby is showing signs of allergy, we are going to start thinking about it. Okay? So 1 glass of milk, 2 glasses of milk is not going to do anything to you. Now, when it comes to baby being allergic, a lot of questions about lactose intolerance. There is true lactose intolerance is very, very rare, and it is only actually diagnosed by a test that is done in a clinical environment. So just looking at signs and symptoms in the baby doesn't qualify as a good enough test for making the diagnosis of lactose intolerance. Okay, so it's a very, very small percentage of babies who have lactose intolerance. So if you've ever been told that your baby is lactose intolerant, then it probably was not the case. What we do see is cow's milk protein allergy. So this is more common. Cow's milk protein. Okay, now cow's milk has a protein which is basically bovine immunoglobulin B. And this is something that can cause a reaction in your baby's body because your baby recognizes it as a foreign agent. Okay, and it launches an attack against it. And this is what an allergy is. Your baby gets sensitized to this. And what are some of the symptoms of this allergy? Your baby could have green, frothy stools, blood in the stools, a lot of crying, excessive crying for more than 3 to 4 hours a day continuously, which does not stop even with, any kind of pacifying, breastfeeding, only makes it worse. So then we really have to consider milk protein allergy as a possible reason. And of course, there are other things that we look at. But when it comes from a nutritional standpoint, yes, is something the mother eating causing a problem? Is it gluten? Is it dairy? Okay. So usually dairy and gluten are the two main culprits. And it can cause, what are some of the symptoms? We talked about green frothy stools, excessive crying, which sometimes is called colic, and reflux. So vomiting out all the milk as soon as the baby has drank it, to a point where your baby is not able to gain weight. So all babies will spit up, that's okay. But if it is interfering with weight gain, and if it is undigested milk that's coming out, then that is something that we need to evaluate. Okay, rash. Your baby could have rash all over its body. This could come from introduction of formula. It can come also from mother drinking, because formula is after all cow's milk protein. Okay. And it can also be because mother is drinking too much milk. Too much, I'm talking about 6 to 7 glasses of milk, which I know some mothers are given because the belief around it is that it will boost milk production. Okay, so eczema, skin rash condition, dry skin, rhinitis, constant cold and cough, all of these things could really go back to what the mother is eating, and the biggest culprit is cow's milk protein. So cow's milk is not as good as we once thought it was. Okay. Also, a lot of antibiotic use with cows, a lot of hormone pumping for the cows today, which is why, a lot of people will say back in the day it didn't happen, why is it happening now? We didn't face any of these problems with our babies, the last generation will say. But the biggest difference now is a lot of things have changed. There's a lot of intervention even at that level, where we are pumping cows with hormones to boost their milk production, giving them antibiotics to prevent them from falling sick. And all of this is causing a problem overall with the microbiome and giving problems to babies as well. So milk protein allergy is something that we look at when we talk about nutrition in the mother and direct impact on the baby. Okay, and what are some of the other issues? We've talked about lactose intolerance. So babies who have true lactose intolerance will have constant gassiness, sometimes blood and stools, constant green frothy stools. And all of these things, of course, if it is first the mothers put on an elimination diet, so we cut out all possible sources of allergies. Can we cut out milk from the food, cut out gluten from the food, and then slowly start adding these things back to see which one is causing a problem. So typically this is done under guidance. So a lactation consultant and a nutritionist would help you along with your doctor to see what is causing an issue and help you get back on track with this. So another question I always get is, what food can cause problems with the baby? Of course, we've talked about milk protein allergy. Some of the other things that can cause gassiness is sometimes eating too much of cauliflower or cabbage. Potatoes also, it's all in moderation. If you're eating it in small amounts, it's not going to make a difference. If you're eating too much of one kind of food, especially cruciferous vegetables, it can cause some amount of stomach upset in the baby. Too much of galactogens, like taking fenugreek in large quantities, also can cause loose motions and diarrhea in the baby. So from a nutritional standpoint, it's important to understand that what the mother eats can cause allergies. The usual culprit is cow's milk, not the mother's milk. Okay, so eliminating cow's milk from the mother's diet may improve symptoms. Unfortunately, sometimes women are told to stop breastfeeding in this case and start with formula feeding, but this is very harmful and dangerous practice, because breast milk is most important, most nutritionally complete, and the best source of nutrition for the baby. Okay, especially in a time like today where we are facing this pandemic situation, it's important to ensure that babies are getting as much breast milk as possible. Also, when we are introducing formula or when we give outside milk, outside food, the chance of baby falling ill is even greater because of the amount of things that come in between the baby and the food, right? So if it's directly from the breast, it's least amount of issues. All right, so I'm hoping that this has covered a lot of your questions about the baby's food when it comes to what the mother eats when she's breastfeeding, the mother's nutritional concerns. One thing that I did not address was weight gain and weight loss. When can you start with going actually on a calorie deficit to lose weight? It's not recommended that you do any kind of dieting when you're breastfeeding. You can start creating a small amount of calorie deficit when the baby is about 4 to 5 months old. Up until then, it's important to eat to maintain your weight, eat to nourish your body, eat to ensure that your breast milk is rich. So the more good fats you eat, the more good fats will go into the food, it will go to your baby, it will help with the baby's brain growth. Okay, the iron in your baby's diet is going to help with brain growth. So all these things are important to understand. It takes about 4 to 5 months for your body to completely stabilize with its milk production. After that, you can start, with the guidance of a nutritionist, start bringing in a calorie deficit to start losing some amount of weight along with an exercise program. So we offer both of these things at Birth Basics to help you with your health, and I don't like to call it weight loss or getting your body back after you've had your baby, but it's very important to get your health back with eating right and with the right kind of exercise. So there is something called as diastasis recti. There is something called as incontinence, which is inability to control your bladder and your bowel movements. Okay, issues with getting back to your sexual activity in the postpartum. All of these things can be managed with eating right and exercising the right way. So very important for you to understand that it's not just about losing belly fat, it's not about getting your body back, but it's about healing, it's about nourishment, and it's about protecting your body from further damage in the postpartum, because this is definitely a delicate stage. All right, so let us now take a look at some of the questions that you have been asking. I'm just going to go down and look at the questions. If you have any questions or concerns, we can address them now. So I have a question from Vandana asking, how can we reduce belly after C-section? So yes, Vandana, this is exactly what I was talking about right now. It's so important to understand that, especially after a C-section, your body is still healing. Nutrition plays a very big role in ensuring that your body heals right. So eating food that is going to be supportive of the healing process. Collagen plays a very important role in this, because healing requires tissues to be laid down, scar tissue that is being formed as a part of your C-section scar. All of this healing is first essential. Proteins that you eat. We've talked about ensuring that you're not overeating, eating the right kind and the right sources of food. All of this is going to prevent excessive weight gain, and overall weight loss is essential to lose belly fat. Okay, so we can't specifically target the belly tissue and say let's lose weight over here. It's overall fat loss along with exercises to ensure that your deep core muscles are engaging well and supporting the internal organs properly. Now when it comes to C-section, there is specifically the issue of scar tissue. So there is a cut that is made that cuts across 7 layers of tissue, and when the healing takes place, there isn't enough movement in these tissues. So what ends up happening is there is something called as a shelf. The tissues get stuck over there and the fat accumulates on top of it, and it looks like the entire belly is hanging over that. So yes, women who have C-sections are always concerned about belly fat because it does look abnormal. It looks like it's all collected over there. But there are very specific things we do for that. So we teach you how to do scar tissue massage to ensure that the tissues are moving well. We teach you how to activate your inner core muscles properly so that it's not pushing the belly down. We check to see if there is a diastasis which is contributing to this look of protruded or bloated belly. It may not even be belly fat, it may be bloating. It may be your internal organs pushing out against a gap, which is called a diastasis. Okay, so we have to understand that your postpartum body is healing. There are experts like a women's health physio like myself, or there are so many women's health physical therapists in India today. So please find one in your city and ask them for support when it comes to this. Why my breast milk is, so Akila is asking is, why does my breast milk egg-like smell? My baby feels like vomiting. Okay, this is quite interesting actually. We'll have to take a look at why this is happening, but it's not very common to have milk that has any kind of odor. It could be the fat content in the milk that is contributing to it. It could sometimes fat becomes lipase, which can cause an odd smell, but this is usually common in milk that is stored. So it would help to increase the amount of water that you're drinking. Afreen's asking, how much weight can we lose if we breastfeed the baby for 1 year? Please help me by answering my questions. Thank you, Afreen, for your question. Now, you are burning 500 calories a day when you're exclusively breastfeeding. Okay? So, the amount of calories that you eat, that you should eat to maintain your weight, is determined by your age, by your body mass index. Okay? It's determined by your activity level. And it is also determined by the extent to which you're exclusively breastfeeding. So, are you exclusively breastfeeding or are you also supplementing with formula? So, of course, until the age of 1, from 6 to 1, you would be probably also supplementing with formula. So, now your metabolism is going to, drop a bit because it's not in an overdrive to make that much more milk. By breastfeeding alone, you cannot lose weight. You simply cannot, because you're also going to get hungry. You're going to make up for that weight loss, that calorie loss, by eating more. So you can, of course, take up this opportunity. When you're breastfeeding, your body is burning more calories. So this is a good time for you to eat healthy, eat right, nourish your body. Don't eat unnecessarily junk food. No unnecessary bad saturated fat. No excess of carbohydrates. Supplement your food with ample protein so that you're not getting cravings for sugar. All these kinds of nutritional changes in your food and daily habits. This is what is essential to help you lose weight in the long run. Okay, and exercising the right way. Even if it is a 20-minute walk every day, a 10-minute walk 3 times a day is what I tell mothers to do, because this is achievable. It's very difficult to fit in an exercise program with a baby that you're taking care of. Constant distractions, constant interruptions. We have our prenatal yoga classes that run, and mothers come in religiously, no breaks. The minute the baby is born, the most motivated mother, I find, is not able to make it to class because of the baby's routine. So yes, just by breastfeeding you cannot lose weight, but it is a good opportunity for you to bring a balance in and optimize, not gain weight is the first, not gaining weight is the first step in the first 6 months. And from 6 months to 1 year, you can really get into a good nutrition program, exercise and burn it off. Okay, but it will take a lot of hard work. It is not easy. Pavitra is asking, my baby is not at all having water, is 2.2 years. Pavitra, you'll have to introduce water in more interesting ways. You can add cucumber to the water to improve the flavor. Okay, you can make sure that you're, even if it is giving some kind of fruit juices diluted with water, but not too much of it, and natural fruit juices without any added sugar. But of course, hydration is very important. So you can add it in the form of soups, and some way to bring in hydration. So don't think of only water, think of lassi, not lassi but chas, think of a lot of watered down yogurt, anything but fluids. Deepa is talking about, I have a 7-year-old daughter, she has a belly, is it okay, shall I go to... Okay, so your daughter could be having a diastasis. A diastasis is a split in the abdominal wall. It can be there in babies also. It can happen in children also. So please do, we are doing online consultations right now. So that is one big advantage of being in this situation. So if you need any help, you can reach out. You can take an appointment, and that is something you definitely need to address. Hi mom, hi ma'am, Vanshika is saying, my son is 7-year-old, he does not eat any fruit or vegetables or not any dry fruits. Now this is a conversation for another time, and it is definitely something that is a talk in itself. How do you get children to eat? You have to be very creative, very interesting, and it is definitely something that we shouldn't force them to do, because it will put them off, and we can talk about that maybe in another talk. Okay, I'm only going to answer questions specific to breastfeeding in today's session. So Shilpa is talking about, is milk powder good to give kids? If yes, which brand should we buy? So no, any kind of milk powder, any kind of supplement like formula from a young age, or in the 2nd year of life, there are additives for milk. It's just full of sugar. It's like giving your baby spoonfuls of sugar. And we've talked about the effect refined sugar has on your body's system. Okay, it's called the hypothalamus pituitary axis. Okay, it puts it in a state of constant alarm, and it causes a lot of inflammatory responses in the body. So definitely not something that you should be doing. It can set your baby up, your child up for obesity. We talk about we don't eat anything, but we just gain weight. How do I lose this extra weight? It is because of this. It is because of this state of mind that your body gets into to store fat, because it's not sure when the next time it's going to get something healthy or nutritious to eat. So completely not recommended, and I would not recommend any brand. My son is 2 years and 8 months and understands everything, says a few words, expresses himself well, but only vocabulary is an issue. Okay, I don't know what the question is there. There's a wide range when it comes to when a child will talk. So I would recommend that you speak to a speech therapist and a child developmental expert for that. It's very important to seek help at the right time. Pratibha is asking how long is postpartum, and I love that question. So you are going to be postpartum for as long as your body takes to heal. Okay, and think of that. It is such an important thing to understand and internalize. I have mothers that I am treating 10 years after they have given birth to their babies for an issue that came up in their postpartum period, immediate postpartum period. Things like leaking when you cough and sneeze. Leaking, yeah, I've asked moms, do you leak urine? No, I don't. I don't, except for when I run. That is a problem. Even if you're 10 years after having given birth to your baby, you're considered postpartum if you're still struggling with these issues. Okay, so once postpartum, always postpartum, unless you have healed your body and addressed issues that have cropped up during your pregnancy and when you're breastfeeding. Postural issues can also come up when you're breastfeeding. Constantly holding your baby like this, rounded shoulders, rib cage drawn down, belly jutting out, pelvis not in balance, pelvic floor not in balance. These things, we women should be strong, absolutely strong, so that we can support our families. Okay? How long is postpartum period? As we stop taking care when baby starts moving. Exactly. So you have to take care. See, everybody has to keep time for self-care. You have to allocate time for yourself. I get up at 4 in the morning so that from 4 to 5 I have time to myself before my day starts, before I start taking care of my kids, before I start taking care of my patients. If I'm going to be tired, I'm not going to be able to help anybody. Okay, so for mothers, we have to take care of ourselves by eating right, exercising, make it a part of your culture. I have an 11-month-old baby, please advise a good supplement. So again, like I keep saying, unless it is medically necessary, I don't recommend supplementing. I don't recommend starting with any kind of powdered food, powdered drinks. Whole sources of food, whole grains, whole foods are the best. After C-section, how soon can I start working out? Is asking Divya. Divya, you can start working out immediately after you have your baby, even if you had a C-section. But the question is what kind of exercises. So initially you will start doing deep breathing exercises, reconnecting with your core muscles, reminding your pelvic floor and deep abdominals what they are supposed to do, because they forget. Once you have about 8 to 12 weeks postpartum, we check to see if you have a diastasis. Okay, if your abdominal wall is doing well, there are no issues with the abdominal wall, the stitches have healed well, you have no pelvic floor issues, then you can start with regular exercise. I would recommend starting with yoga. Walking you can start even by about 3 to 4 weeks, no problem. You should do it. As soon as you had the baby, you should do it. As a form of exercise, 10 minutes 3 times a day, starting 3 weeks postpartum. 8 weeks to 12 weeks post C-section, I would highly recommend checking to see if you have a diastasis. If you have a diastasis at 8 to 12 weeks postpartum, we need to heal it. If you don't have a diastasis, then you can start doing gentle yoga and move into Pilates is a very good form of exercise to start with. Once you have really gained strength and control of your core muscles, you can start lifting weights. High intensity interval training like jumping and landing and CrossFit, running for long periods of time, you definitely need rehab to get back into. Otherwise, you will have issues. There will be issues, you will just not report it. Can intermittent fasting help reduce weight? Now, I have, yes, of course, there are a lot of benefits of intermittent fasting. It helps people who are diabetic, it helps people who are struggling with certain imbalances, but I don't recommend it for breastfeeding mothers because you need to have a steady source of nutrition. Your body can go in a state of stress, and there's a lot of increase in cortisol with intermittent fasting for a long-term period. Okay, for short bursts, intermittent fasting is effective. But if you continue it without supervision, without professional support, I see people just reading up online and doing it. No, that is not recommended at all because it can put your body in a starvation mode, which means that it doesn't know when the next meal is going to come in, and that can cause problems. So yes, under supervision, under guidance, it is helpful. I don't support it for breastfeeding mothers, but for if you're not breastfeeding, then you can do it under supervision and only if it is indicated for you. Otherwise, eating a balanced diet is the best. Think of nourishing your body. Don't think of weight loss. Weight loss will automatically come if you're putting the right amount of calories in a small deficit. Okay, think about it this way. You need to eat. See, for every 3,600 calories extra you eat, you will put on 1 kg. So every 3,600 calories less you eat, you will lose 1 kg. Okay. So this deficit to 3,600 calories less than you are burning, you can only create by eating a little bit less every day, maybe 300-400 calorie deficit every day, and exercising so that you are burning more. Okay. So you can lose safely about 1 kg per week after the baby is about 6 months old. Does protein powders help during breastfeeding? Excellent question, Meghna. Thank you very much for asking that question. Yes, protein is very, very important, but when you're breastfeeding, we would recommend vegan protein powders. There are many vegan protein powders in the market. You can look it up. You can find them online. But yes, vegan protein powders would be better because most protein powders are made with cow's milk. Again, whey, okay? And we don't know, but it could cause a problem with milk production. And some protein powders can cause constipation, which can be an issue. So look at pea protein as an option. Look at collagen protein as an option. These are both very good sources. My baby is 4-month-old and he's having some pimple-like marks on the nose. Okay, that you'll have to get checked by the pediatrician. But a lot of times babies do have newborn acne. 4 months is a long time though, so by now it should have settled. Beena is asking, I'm gaining weight also, what food and exercise should we do? Yes, if you're going to eat more than your body needs, you will gain weight. If you're not exercising to burn that extra food that you're eating, you will gain weight. So like I have mentioned already, you need to eat a balanced diet. You need to make sure that you are getting enough carbohydrates, proteins and fats with every meal you eat. We do have a nutrition plan that we put into place for you if you're a breastfeeding mother especially. We do support you with starting with the right kind of exercises in your postpartum. So if you want to work with us, definitely do give us a call, or you can I would recommend doing it under supervision. So find someone who is trained in pre and postnatal support. It could be a fitness instructor who has a certification, or it could be a physical therapist who specializes in this. My baby is 1 month and 28 days old. I breastfeed her, but in one day I have to give her formula milk at least twice or once. Is that okay for the baby? 1 month and 28 days old. So you're giving only one formula feed a day. You can very easily boost your milk production to make sure that you're exclusively breastfeeding, Divya. So it's very important for you to look at ways to boost your milk supply. Okay. It could be in the form of post-feed pumping sessions initially, once or twice a day, or you can do cluster pumping. So in the evening, pump often, every 10 minutes, pump for about 3 to 5 minutes, and that'll give you a small boost in your milk production. You can have galactogogs like methi ka pani for 5 to 7 days to give you a small boost in your milk production. Okay, and you can easily cut out this formula. It is not good. Obviously, we want to minimize giving formula to the baby. It's unnecessary, it's external. Baby's only 1 month and 28 days old. You know, and especially during this COVID period, I'm just telling moms, please cut out formula if possible. Give only from the breast, because your breast milk has antibodies, and it is going to protect the baby from falling sick. Even if your baby falls sick, it will be a milder version of the illness. Okay, so we know that even if babies get COVID, it's not the more serious version of it, but being breastfed is going to protect your baby even more. Purba is asking, my baby is 1 month and she makes sounds like constipation and struggles to pass gas. Is it because of my food intake? Yes, Purba, we have to look at why this is happening. If it is happening often, I would highly recommend doing a lot of tummy massage, putting your baby on the tummy, doing tummy time, holding the baby in the colic hold position where the stomach is against the forearm, feeding your baby often. All of these things will ensure that baby is passing stools well. If your baby sounds like it's constipated and struggling to pass gas, this is something that you can avoid by giving the baby more activity, more movement, more tummy time, doing a little bit of massage to help the process. Okay? Not likely. Constipation is not very likely to be because of what you're eating. But it can be because of iron supplements. All babies get iron supplements nowadays. So if your baby is getting iron supplements, it can cause constipation. Yeah. Now, so that's why I keep telling mothers that it is best to have your iron tablets properly and eat good sources of iron when you're pregnant. Encourage delayed cord clamping or optimal cord clamping. Don't clamp and cut the cord right after birth, so that the baby gets all the iron reserves from the extra blood that is circulating in the placenta, instead of giving iron supplements in the postpartum period to the baby who can get constipated. Okay. So Nargis is asking, my daughter doesn't take milk. She's 3. What should I do? Will it impact her immunity? No, we just talked about it. Milk is not so important. Okay, it's perfectly fine if your daughter is not having milk, but of course your daughter needs to have good sources of calcium. You can give it in the form of yogurt. Yogurt is equally good. Good source of protein, it's a good source of calcium. You can give broccoli if your baby is going to have that. Yeah. 3-year-old, so she should eat all these things. You can add it in a soup. Renu is asking, my daughter is having cough in her lungs and often runny nose. So this, please check to see if it is because of milk. A baby who's constantly having runny nose could be because of cow's milk. Okay, so definite recommendation to minimize the amount of, you can talk to your doctor and see if cutting out cow's milk for even 1 week sometimes we find makes a huge difference. Then you can recognize that this is the source. Okay, so cow's milk should be cut out from all sources, like the food, in cooking sometimes we add milk, and that might give you an idea if that's what's causing a problem. Okay. Alright, so those are all the questions. If you have any more questions, please do share it. It was really nice having this conversation with all of you through Breastfeeding Week to encourage. And remember that no matter what you eat, breast nutrition only plays a supportive role when it comes to breastfeeding. What is going to matter is how the baby is latched. Is the baby removing enough milk from the breast? Okay, is the breast getting stimulated enough? The more stimulation you give, the more demand you create, the more milk you will make. And in spite of doing all these things, if you are not making enough milk, then is it because the baby has a tongue tie? Is it because the baby has a problem with the oral anatomy that is preventing the baby to latch properly and suckle and extract milk? Or does the mother have a primary issue, like not making enough milk because the amount of gland she has is less? Then what is the point of going on eating, going on pumping? Of course, it is going to make some amount of difference because it is going to play a supportive role. But you need to know why you are not making enough milk. And that is something that we want to encourage you to understand, because whenever it comes to breastfeeding, the question that we are tired of answering is, what should I eat? What should I eat to make more milk? What should I eat to make more milk? But it is a purely supportive role. Okay. All right. Mehvash, I will answer one last question. Mehvash has asked, my daughter's 4 years old and she doesn't eat anything in a day, only dal and chawal. Okay. So again, you know, your daughter is 4 years old. So you're going to have to really make it interesting. It's not easy, yes, but at the age of 4, you can start, even sooner, you can start talking to your child about the importance of food as a form of nourishment. And this really works. I will tell you, even I have a 4.5-year-old. And the only thing that works is explaining that food is important for you to function. Your mood, your state of mind. We constantly make correlations between how you're feeling and the importance of eating right. So you're going to have to spend a lot of time talking to your child, also demonstrating, kind of mirroring the habits that you want to see in your child. Okay, so model good behavior, especially when it comes to food. My baby is passing loose stools more than 3 times a day. Kindly suggest remedies. Okay, it really depends on your baby's age. And if it is a newborn baby, then it's normal for them to pass loose stools very often. That's how newborn baby stools are very runny, very watery, mustard yellow, bright yellow. So a lot of times mothers think it is loose motion and diarrhea, but it is not. If your child is an older child, you will have to seek help from your pediatrician. Iti is asking, my daughter delivered a baby 1 month back and having a lot of joint pain. Okay, this is a good question, very relevant in my scope of practice. Please do, you will have to do a comprehensive check to see what it is that is causing this problem. If it is, multi-joint pain, like the fingers and toes and knees, more than one joint involved, then we have to see, if it is some kind of rheumatoid arthritis or some kind of postpartum inflammatory condition that is causing this response. Sometimes, and not sometimes, many times, just nutritional support and some exercises to improve circulation in the joints. Gentle yoga, which we do for these mothers, helps them significantly to find a balance and to decrease. No need of any medication and all. Of course, we have to see why this is happening. Another reason for joint pains could be a thyroid imbalance. A lot of times there could be pain in the hand, the wrist. Decovens tenosynovitis is called mother's thumb. It's very common because of combination of things, swelling in the hands, thyroid imbalance, carrying the baby, overuse. So we'll really have to do a thorough assessment of what the condition is, and this is a time to treat it. You don't want her to feel this way as she's entering motherhood. Barsha is asking, my daughter is 6 years old, her weight is too much, I want to decrease her weight. Well, it is important for her to start with a lot of outdoor exercise, and that's the healthy way to do it. Okay, so don't keep talking to your child about her weight, don't keep pointing it out, please. She's only 6 years old. It will help for you to cut out junk food from her diet, but it's very important to create this environment of health and nutrition around food. If you're constantly referring to weight, it is going to plant that seed in her mind and she's going to look at it very negatively. You can be overweight and you can be healthy. Okay, you can be very thin and you can be unhealthy. So think of exercise, think of eating, more vegetables, more proteins. Talk to your child about it from a nutritional standpoint, because you can then, cause problems, especially in girls with, some kind of food problems like anorexia. Yeah. Okay, I've said this I think more than once, but I think it's 5 o'clock and I'm going to take the last question now. My son is 1.5 years old. I'm breastfeeding him, also eats regular food. Should I alternatively feed him formula? Not at all. If your baby is happily drinking breast milk, you have more than enough for your baby. I would highly recommend skipping formula, skipping bottles. Bottles are the worst. So please skip it. Just give water from a cup. You can introduce cow's milk at some point. Of course, it's not very necessary, but 1 cup of milk is what is recommended at this age, and if it's coming from you, that's brilliant. But 1 cup of external milk and unlimited mother's milk, how much ever he wants to have. Akanksha is asking, my child is almost 2.5 years, but she doesn't eat solids, she eats mashed food, also her weight is not increasing for so many months. Yeah, so this is something that we need to inculcate very early on. When we transition from breast milk to solids, it's very important to introduce different textures very early. Encourage your baby to eat on her own, encourage your baby to reach out for the food, not give only mashed food when we are introducing. Now at this age, it does become a little bit harder and it will take some effort from you. And you can also talk to a speech therapist, work with an occupational therapist for this, because they will take a look at the oral anatomy and see if there is something preventing the baby from swallowing, or is the texture causing a gag response. So 2.5 years, still not eating anything but mashed food. Yes, maybe you can try for some time to work with it, and if it doesn't work, then definitely take professional advice. Okay. All right. Thank you so much for tuning in. Today's talk was, brought to you by FirstCry and FirstCry Parenting, and do follow them for information like this. Do follow me on Birth Basics as well. If you're interested in hearing more about pregnancy, breastfeeding, and the postpartum, do share this talk with as many mothers as you think will benefit from it, and get in touch with me if you have any questions, any concerns. I'm here to help. Okay, thank you. Once again, I'm Sonali Santhanam from Birth Basics, and I'm here to answer your questions. You can post them, and anything that comes up we will answer later on.